Alright, hi guys. Sorry, I kind of have a cold here. Just getting over a cold. I've had a cold for like a few weeks here. Hi guys, I hope you're doing well. I apologize for the delay in my posting and videos. As always, it seems like I'm just kind of a mess all the time. I've been sick, just getting over a cold. I actually filmed this video back in September. However, clinicals and with school and everything, it's just been super hectic and busy, and I haven't had a lot of time to edit, post, upload, film, etc. So I really am very sorry that I haven't been uploading and commenting and being as active as I normally am. The good news is that I graduate here in a few weeks, and so I hope to be more active once I graduate and will have more time on my hands. So as a new nurse, almost new nurse, I thought that I would just compile a few helpful words of advice and hints and tips on how to work through some of the challenges of nursing school and what really helped me as a student nurse. So I hope you all enjoy, and thank you for watching. Hi everyone, and welcome to Maddie Vlogs. Today I'm going to be giving some tips on nursing school and how to be successful in your education. I know that nursing school can be really hard and really daunting and scary for a lot of people. It's not easy. So I'm just going to talk about a few helpful words of advice on how to navigate through some of the challenges of nursing school and finishing your Bachelor of Science of Nursing, if that's what you're going for. So currently I'm in my fourth and final semester of nursing school. So I will graduate in December, which is incredibly exciting. I will be in the emergency department this semester for my senior practicum or capstone, for my final clinical placement, which is incredibly exhilarating, and I'm very excited. I was in long-term care for my first semester, and then I was in acute care, then I was in OB, labor and delivery, and pediatrics. So I'm excited to have a little something new in the emergency department. So one of the most important things of being a nursing student and being successful is organization. Be organized, have papers, binders, pencils, pens, highlighters, notebooks, folders, just everything to kind of keep all your papers in, just to keep things really organized, and that'll really help you when it comes time for exams, and you just have everything kind of already put together almost in like a little book that you can just go through and review. So the first step is really getting organized, getting all your materials, and being prepared for school, whether that's notebook, journal, folder, binder, pens, pencils, highlighters, flashcards, note cards, little post-it notes. I know a lot of people use those, and that's very helpful. Additionally, paper clips and other types of office supplies. Also really know your learning style and how you learn best. I know a lot of people are auditory learners, others are visual learners, others are tactile learners, which is like touch. So it's really important to know your learning style and how you best synthesize information. I know for me, I'm a visual learner, so I do best by learning through videos and seeing things. So in that regard, my study plan might look like, watching a series of YouTube videos on a topic, and then maybe going and drawing the concepts out on a sheet of paper so I can visualize the processes. Another important thing is taking notes. Whether it's in lecture, PowerPoints, whether at home or reading from a textbook, taking notes is very important. That helps you really synthesize the material and kind of understand what's going on, especially if you put it into your own words, and just take the time to comprehend and understand the material. And then that ability to write it down really helps your brain implement the material into your brain and kind of helps you remember it better. So really take advantage of taking notes if you have in-person lectures. If you have online PowerPoints, definitely take notes from online PowerPoints, watch videos. I highly recommend looking at the additional resources that professors post on sometimes their online pages or resources that they have for you to look at. Those are for you to help you, and so I highly recommend that you take a look at those because they will help you, such as Khan Academy or other resources that are excellent for nursing. So another thing, and this might seem difficult, but make time in the day to study, whether it's 2 to 3 hours or 4 hours or 5 hours. I know this might seem like a lot, but it actually really helps. And the shorter you break it down into smaller chunks, the more you're able to actively gain and remember that information as opposed to cramming all in the last minute. So 1 to 2 hours every day, that's not a lot, but it's really recommended to do at least 3 to 4 hours every day. That can be 2 hours in the morning, 2 hours at night, just reviewing your notes, watching videos, looking through the PowerPoints, listening to the lectures, going over the book, just really kind of solidifying that material and your knowledge base can be really beneficial. Now, having said that, it's also important to take breaks. You don't want to be studying 24/7 where you're constantly fatigued and just burnt out. That happened to me my first semester. I was constantly studying and I didn't perform very well. And I think that's just because I was constantly so stressed and just so wrapped up into my studying and my thoughts that I didn't really give myself that break and that time to relax and be a normal person. You have to remember that in nursing school, you're a nursing student and school comes first, that's your priority, but you're also a person who has needs and wants. So it's okay to give yourself a break every once in a while and reward yourself. That's really important. Another thing that's also really important is asking for help. I know this can be really daunting for a lot of people and you might feel like you're stupid for going to the professor and asking for guidance or clarification. And I know I felt like that a lot when I was in high school. I really did not want to go for help. It's really difficult to advocate for yourself, especially when, if you're a perfectionist or you want to seem like you're really smart. I know I had that issue a lot. But really taking that step to be an advocate for your own education is pivotal and will really help you succeed in the long run. So if you're confused about a topic, truly reach out to your professor or your instructors and ask them if they can help or if you can meet with them and to go over some confusing topics and material, and hopefully they will help you or direct you in the right direction to where that you can get additional practice if needed. And also, I know that this method may not be great for a lot of people, but it also works well for others, is formulating a study group. Sometimes having a study group can be a great way to bounce ideas off of each other, discuss the topics, and kind of better understand the concepts. But for others, it can be kind of a distraction, and so you just really depends on someone's learning style. But if you really do like talking it out, or if you're more of an auditory learner, study groups can be a really great way to really help facilitate and synthesize the material as well. Another thing is mix up your study method. So instead of just constantly reading the textbook or just reading over your notes, mix it up a little bit. Watch a YouTube video, write down notes from the YouTube video, draw a diagram, maybe listen to something online or a podcast, and don't take notes, just kind of study in different ways to help facilitate that knowledge base. And again, as everyone has a different learning style, so definitely do emphasize your own particular learning style. It wouldn't be, in your best interest to do auditory learning style if you're a visual learner, or vice versa. But, definitely try to implement new ways and new methods, as it'll help kind of just cultivate a better learning experience for you and help you be more well-rounded, as opposed to just reading the textbook or just reading your notes or only watching a YouTube video, etc. And I can't emphasize this enough, that writing things down is really important. I know, especially for me, watching a YouTube video, but then at the same time writing it all down, what it's saying, and looking at, the process of what's going on the video, and then, implementing that on my own paper through my own writing. That's so helpful, and it really helps me visualize the process. And then when I go back and look at my notes, I can be like, oh yeah, this is how this works, or this is why that happens. And I can better apply it to the knowledge and how to apply it to patients in the clinical setting and the medications. And it's just such an important aspect of studying. Also, part of nursing is having long days. So most of the time you will be in clinical for long hours, 8 to 12 hours. You'll be in lab for long hours, or school or simulation. So make sure to pack enough food and water to sustain you throughout the day, and just be prepared for long days, with comfortable shoes and the right appropriate clothing, and come prepared to school with all of your necessary supplies, such as blood pressure cuff, stethoscope, pen light, watch, and all those other necessary supplies and equipment that are required of you from your school. And that'll be really helpful for going forward, and just helping you be prepared for the day, along with having all of your notes and checklists and all that information. So prior to exams, I know exams and tests can be incredibly stressful. I'm not very good at test taking. I can understand and explain the material much better than I can take tests. However, practice tests are very important. The ability to, once you've understood or learned a topic, is to go back and assess yourself and see how much you do know. Answer the questions at the end of the chapter. Try to find questions online related to that topic. There's tons of study questions all over the place related to nursing topics. And you can just find a ton of questions all over the place. And so really do take the time to answer those questions. Also, because nursing questions are in a different style, though the way that they're formatted is much different. In my experience, the way that the questions are formatted are much different than tests that I had taken in college and in high school. So being familiar with the style of just the writing style of the question itself is really crucial to success. So by utilizing external resources and taking additional tests and quizzes and practice problems, you'll definitely be helping solidify and enhance your knowledge base when it comes to the actual test. The best way to practice for a test is to take tests, and to really make sure that you understand the material. The other way to also study for exams, aside from taking practice tests, is to pretend as if you're teaching the material to someone else. I know this might sound kind of crazy and silly, but pretend as if you are teaching someone. So talk it out loud. Teach the material to yourself. When you're going through your notes, try to cover it up. And if you can explain to it, over and over and over again, without the need to really look at your notes or look at the book, and you can just explain the process, 100%, then you're generally pretty good to go. It's the reading of the material, just kind of word for word, doesn't help synthesize it as much as either writing it down or speaking it out loud verbally and talking to others, or pretending as if you're teaching and talking to someone. When you go to lab, generally you will be doing skills such as focus assessments, medication administration, IVs, catheter insertion, chest tube placements, etc. And some of these skills can be a little bit tricky and complicated. So prior to going to lab, I highly encourage you all to look at videos on YouTube on these specific skills. And that way, when you go to skills lab, you will be focused more on performing the skill and getting it down in muscle memory, as opposed to learning how to do the skill or what the steps are. So make sure that you have your general knowledge base of how to insert an IV or do medication administration. And there's tons of videos and resources on YouTube and other places to help kind of solidify and implement this information. So really do make sure that you're taking the time to review those skills ahead of time, because when you get to lab, lab is so short, and you want to take the time to really master those skills, and instead of learning it from scratch. And so that's another important piece. Nursing school is also incredibly demanding. It's exhausting, it's stressful, it's a lot of pressure to do well and to succeed. And so having support from family and friends is essential. Let them know when you're having an exam. Spend time with them when you can. Support can really help you succeed when you're in nursing school. It's also incredibly important this is one that's often forgotten about, but is just as important, is your own health, your own physical health, your own mental health, your sleep, your nutrition, and your hydration. Make sure that you're taking care of yourself. And so make sure you're getting at least 6 to 8 hours of sleep every night. Make sure you're eating a well-balanced diet. Make sure you're getting in enough water daily, and are exercising when you can, as these are so important to your health and to help alleviate stress and to just help your brain function better for nursing school. If you have any questions, or if I've forgotten anything, please let me know. I'll probably be doing another one of these videos at some point. But I'm just super excited. I love nursing school so far, and it's just been a wonderful experience. And these are just some of my takeaway points of things that have kind of helped me. And really advocating for yourself is, I think, one of the most important things that you can do in nursing school. Advocating for yourself. If you're confused, you can't just be passive and sit there. You have to be proactive and take responsibility for your own learning. You have to, research the topic. You have to read the lecture, read the book, go to the professor, schedule an office hour appointment, go do the lab skill practice if you're feeling uncomfortable with any of the skills. I know most professors and most instructors are very willing to help you, and they want to see you succeed, because you will be a nurse one day, and the decisions will be in your hand one day. So it's really important that you get what you need out of nursing school while you can, prior to entering into the workforce. And this is ultimately for you and for your career and for the benefit and overall well-being of your patients. So take advantage of it. Have fun. It's a really lovely, exciting process, even though it's challenging and stressful at times. Another thing I forgot to mention is, within the study tips, is another way that you can study is to make flashcards. I know there's a lot of memorization involved in nursing. However, it's better to understand the process of how it all connects to each other. For instance, instead of memorizing the side effects of a beta blocker, you want to understand how the beta blocker works in the body and how it ultimately affects blood pressure, and side effects that can result as a consequence of the process and the physiological pathophysiology. So once you have a full, overall big picture understanding of the processes, generally the side effects are easy to follow, and you don't have to sit there memorizing all these side effects of a certain medication, because you should know it. That, a beta blocker is used to lower blood pressure. So for instance, a side effect would be hypotension or low blood pressure. Or insulin, for instance, is used to regulate glucose levels. So a side effect of insulin could be hypoglycemia, which is low blood sugar. So you just want to be mindful of that, and also then knowing symptoms of hypoglycemia and what that can look like. And so just, dizziness, faintness, of just what happens when you have a low blood sugar. You just want to think about that. And I'm sure you can know in your day-to-day experiences how that relates to life and real life circumstances. So nursing overall is a huge journey, and it's a wonderful opportunity, and such a privilege. And so I hope this video helps at least some of you. And if you have any questions, please let me know. Don't forget to like, subscribe, and I will see you in the next video. Thank you for watching. Take care. Bye.